right now at 10, new information on the spread of MERS here in the United States.
The man from Saudi Arabia, who was one of 3 patients, was released from a Florida hospital. The 2 other cases of MERS in the U.S. are in the Midwest. One man in Indiana, the other in Illinois.
Now, there are no MERS cases here in Iowa, but hospitals and health officials do say they're prepared if it is to happen. KCCI's Laura Nichols joins us live from Mercy Hospital to explain. Laura?
Kevin and Stacy, this 3rd MERS case in the U.S. is the first case where we've seen it spread from person to person, and that has hospitals on high alert and ready to go.
It's not something totally new. We in public health have known about it for quite a while.
There are no confirmed MERS virus cases in Iowa, but the state's medical director and epidemiologist, Dr. Patricia Quinlisk, says that doesn't mean it won't ever happen, and she wants area hospitals and clinics to be up to speed.
We put all the things into place just in case it comes here.
Warning signs are in airports, and flyers like this from the CDC are circulating around clinic waiting rooms. Quinlisk says hospitals are also ready to go with respiratory isolation rooms to minimize the spread of the potentially deadly virus.
They'd be in a special room with special airflow, and everybody who walks into that room is wearing a mask.
Symptoms normally include fever and a cough, maybe even pneumonia. If you have these symptoms and have traveled to the Middle East recently or been around someone who has, Quinlisk says you need to call a doctor to set up a private test instead of going to a crowded hospital waiting room.
We want to do the test right here, right now, that we can do it quickly, and we know right away whether or not that person is carrying that virus.
Health experts say MERS won't necessarily spread from a handshake, but it will from coughing in someone's face. Even so, Dr. Quinlisk says Iowans shouldn't be panicked, even if they're planning to go overseas to the Middle East.
The chances of you picking it up by being a tourist is almost 0.
Now, Dr. Quinlisk says there's kind of a common denominator in all these MERS cases. Every one of them has been a healthcare worker who's gone overseas to the Middle East. So Iowans, she says, don't really have to worry. Even if you are going over to the Middle East for a vacation or a business trip, you're not a healthcare worker, but you're going over there. She says, don't be worried. Just be cautious. Wash your hands. Be careful. And, of course, if you do have the symptoms, then come back and call your doctor for a private test. Kevin?
All right, Laura, thank you.